As we age, our lifestyles can greatly affect how we look, and your face may not age at the same pace as your body. 62-year-old identical twin sisters Melodye and Ileane have spent their lives looking like each other's reflection. Self-professed health and fitness enthusiasts, they say they can run circles around 20-year-olds. But to them, the mirror tells a different story. Their youthful bodies simply don't match their faces. And now, those faces no longer match each other. Joining us now are Melodye and Ileane. And
welcome.
First of all, you two look great. I love you saying that you can run circles around 20-year-olds, but I want to ask you objectively, or I should say subjectively, what's your biggest complaint?
Overall, fitness-wise, I feel like I look pretty good for this old lady, but I look in the mirror and I just see the droopy jowls and I see the wrinkles and the discoloration of my skin, and it's just not how I feel. I mean, my face is saying, who are you? And I feel really good. You know, I teach a bunch of formats at the gym, and I can Zumba around most 20-year-olds. I just can't Zumba around my face. So I need some help.
Well, I think both of you look fantastic.
Thank you.
But I'm curious, but of course we want you to feel good when you look in the mirror. That's what's important.
Right.
So have you tried anything in the past, fillers or surgeries?
We've done some fillers, and we've done some Botox and all that stuff. I think because I work out so much, because I teach 12 to 15 classes a week, I think that stuff just it just sucks in.
It doesn't last very long.
Now, is this involved in fitness as well?
I'm not. I work full time, but I take 7 classes a week.
And
I do every
12.
single day. She does 12. So she can go around me, but I do my best to try to keep up with her because we are identical twins, and it feels strange to not look alike. And
we want to stay the same.
Is that part of the issue that, because in some of those pictures going back when you were younger, I mean, you two were dead ringers for each other. So you've progressively seen a little more of a difference changing.
Yeah. Yes, I mean, we're changing body-wise. We're similar, but I just look in the mirror and I go, that's not me. That's not me.
It's so fascinating to have identical twins because we know that your genetic makeup, your basic footprints are identical.
Right.
But it gives us the unique ability to study the effects of outside influences on how their health in general, but in this case we're talking about how they're aging. So I'm sure you two probably had about the same amount of sun exposure.
Yeah,
and
we laid out in the sun forever back in the day.
Very similar, right? Yeah.
Neither one of you are smokers or drinkers.
Well, we both used to smoke years ago.
Years and
put that together, you do everything together.
We do everything together.
We do.
I don't even know why, but we do. We do.
So nothing to excess. Now, are you at the same weight?
No, I'm actually heavier, a little heavier, but I don't work out as I'm the fatter twin. I don't exercise as much
and
as her.
We see the effect of carrying a little more volume in the face. That makes the aging changes different. I mean, you both look great. You both look much younger than your age, but the fact that you've lost volume in your face, giving you a little more of a gaunt look.
Yeah.
So the volume in your case is probably helping to keep your face more youthful.
And I just want to make sure I am clear on this. Although the two of you want to continue to look like twins, it's not as though you need to look exactly the same like you used to, right?
Yeah, because no, we don't. We just want to still look the same and still freak people out as much as we can.
Yeah, we just want to look in the mirror and feel better about what we're looking at.
As much as individuals as twin sisters.
Right.
Is that fair to say? Okay.
I mean, I've always had a little rounder face than her. I mean, even though we are identical twins, there are some differences. But the fact, though, that she is thinner makes her face look different. But we still want to look the same. We
know we're going to be a little bit different.
Right.
Okay. Well,
and that's all doable. It's all doable. It's just that you would have to create specific treatment plans for each one of them, a little bit different. But in the end, they both will look good and more similar.
And I'm glad you brought that up. I think we have just the guy. Joining us now, plastic surgeon Dr. Rady Rahban joins us via Skype. Doc, welcome to the show.
Rady, how are you?
I'm great. How are you doing?
You know, I think you've overheard some of the conversation, but so many of the things that we've learned as far as developing techniques, what works better, were actually done in studies we've done in plastic surgery using identical twins.
That is correct. I've been looking at these beautiful ladies' photos for the last day or two now, and as you have all said, they look remarkable. I think, both of you look fantastic. I think that has to do with, and I commend you for your lifestyle, because when we say people look good for their age, it's not accidental. While genetics are important, a lot of it has to do with lifestyle, and you guys are the epitome of lifestyle. And I agree with Drew. There's a lot of things that we can tweak and tailor to you each individually that can make a big difference.
Oh, that's cool. Thank you. I'm excited. Yeah.
Well, and you should be, because you guys mentioned all the tools in your arsenal. I know that you would have to evaluate them in person, but yeah, I know you have something you'd like to share.
Yeah, I think I want to help you guys out. And so how about this? I'm going to offer to help take care of you guys for gratis, for free.
Wow.
So what I was thinking here, and just to give you a little understanding, as Drew had mentioned, I think each of you will require, obviously, an exam. Photos are helpful, but never as good as meeting in person. And then we need to kind of do what we always do, which is kind of take a moment and go through each of the elements as you've changed and discuss your options. And, in combination of some non-surgical things like the Botox and filler that you've been a little underwhelmed with, but in combination with a few other things, I think you guys are right there.
Thank you.
Well, the only thing we ask, ladies,
So cool.
the only thing we ask of you that you're willing to come back and reveal the results. Are you game?
Yeah,
We're good. Thank you so much.
We look forward to it.
Thanks for coming on. Dr. Rahban, thank you so much.
Thanks, Doc.
Let's take a quick break.